Money worries affecting mental health as well as issues around the financial distress of consumers has been described as a silent crisis. It comes as the world marks Mental Health Day. Several reports from the likes of DebtBusters as well as JustMoney.co.za have raised the alarm over the impact of depressed finances. Operations Manager at JustMoney.co.za, Sarah Nicholson, speaks to us now. Thank you so much for your time, Sarah. It's an important issue to speak of, that correlation between financial distress as well as mental well-being. Where do we find that link?
Absolutely. Well, you just mentioned now the polls. So the second annual Money Stressor Tracker from July 2023 this year, which polled subscribers to the debt counselling company DebtBusters website and platform, attracted about 35,000 responses. And the results really indicate that 3 out of 4 South Africans are feeling that money stress. That's 12% more than previous year. So what we're seeing is, women in particular, they can confirm that the effects of financial stress at home, at work, and on their health it's really having an impact. Our lower income earners are more stressed, and while those who earn more, they tend to have a higher level of unsustainable debt. And this is really creating a severe feeling of shame and fear for so many people who are struggling with their finances. And what we see is that people in these types of situations might not be thinking clearly. They might go into automatic flight or freeze responses. So there is a number of things that are impacting this. And unaddressed mental health conditions, including depression and anxiety, are costing the South African economy about an estimated 161 billion per year, according to the Investec Focus Radio South Africa. So it really is having a big impact, and we can see that in the results when reaching out to South Africans.
How do we quantify that number of mental health matters fueling basically the cost of dealing with not only financial distress but individuals who are unable to keep up with their fiscal demands, seeking the medical attention that they would need to at least cushion them in this regard?
It's really people being unable to, tackle their money stress. We're seeing, with these numbers coming through, that people are literally unable to manage that. And we need to be aware of our financial situation. We need to be looking at improving financial literacy and budgeting and planning so that we can actually deal with these crises. And it's important for South Africans just to take note that they're not alone, and there are ways to deal with this.
Let's talk about those ways to deal with the current situation that we are discussing, because the rising cost of living doesn't look like is going away anytime soon in South Africa, and more consumers are finding themselves even further indebted than they were, say, 3, 4, even 5 years ago. So where does one find help, and in what form?
My top 4 tips would be being aware. So assess your financial situation. It's a hard first step, but by doing that, you really take the time to list your income, expenses, your debts and your assets, and you really understand where you stand. And that's the first step towards making those positive changes. The second one would be also improving your financial literacy, taking time, going through to different platforms and even Just Money, just to empower yourself with more knowledge and skills to actually manage your finances. That can also help alleviate your stress if you're understanding things more. And then also budget and planning. It's so important to put some time aside to budget and plan, and make a date with yourself every single month and once a year where you sit down and you go through your budget. And you create a realistic one, and you assess where you're at each month and every year. And then also really important is to prioritize your expenses. It's good to differentiate between essential and non-essential expenses. And you want to make sure that you are covering the necessities such as housing, utilities and groceries and debt repayments. And where possible, cut other costs while you are dealing with the situation. And then also reach out to, your medical aid. There are various medical schemes. And all medical schemes in South Africa, irrespective of the plan or option, are legally obliged to treat payments for mental health conditions. So it is important that you reach out and, again, as I said earlier, understand you're not alone. Reach out and get the assistance that you need.
On that latter part, Sarah, is the South African climate at least at a point where it's conducive to raise your hand and say, I am in financial distress and I'm more worried about what then is going on within the mental wellness type of status within how you operate, not only as yourself, but as part of a family or an organization?
Available to many South Africans now. I do believe that based on various areas and where you're from and based on your situation, that it can be quite different. And I think that's again why it's so important to make sure that you are educating yourself, you're making yourself aware of what is available out there to assist you, as it is very dependent on where you are at in your current situation.
Thank you so much for your contribution. Operations Manager at JustMoney.co.za, Sarah Nicholson, speaking to us right here on the Business Desk on the AM Report, discussing the importance of balancing mental well-being as well as financial health.